Here he comes.
I figured. Okay. What is a sedentary lifestyle? It is when someone is lying down, sitting, or not moving around for most of the day. If we compare our generation to our parents, grandparents, and great-grandparents, we have become dangerously inactive. Dr. King, a professor at West Virginia University, stated, about half of people 20 years ago said they exercised regularly, which meant 3 times a week, and that rate is only about 18% now. And that's an astonishing change in just one generation. Whether you are in school, at home, work, or out in the community, people are constantly trying to find ways to minimize movement and muscular activity. Inactivity not only puts you at risk for obesity, but weakens the bones, affects sleep and metabolism, and decreases your immune system, causes poor blood circulation, and can cause a hormonal imbalance. According to the American Heart Association, sedentary jobs have increased 83% since 1950. Physically active jobs make up less than 20% in the U.S., down from roughly half of jobs in the 1960s. So how much does sitting around actually affect our health? Dr. Aaron Mischos, a cardiologist at Johns Hopkins, stated, sitting for long periods was associated with worse health outcomes, including heart disease, type 2 diabetes, certain cancers, and certain cancers. So even if you work out for 30 minutes a day, but sit for the other 23 and a half hours, your health is still at risk. So what changed in the last 60 years that allowed a decrease in activity? Technology and improvements in medicine. According to Lifespan Fitness, technology has brought about more inactive modes of transit, caused an increase in sedentary jobs, and has developed more activities that can be done while sitting down, like TV, internet, and video games. Dr. King stated, studies show an increase in life expectancy, but this doesn't mean we're living a healthier life. There are many causes of inactivity other than laziness. It could be paralysis, loss of limb, or lack of education. Fortunately, paralyzed individuals can have someone perform passive range of motion exercises to decrease their risk of blood clots and to keep the blood flowing. Those that are paralyzed and possibly have lower body amputations can use upper body cardio machines. Education is key, and I know there are a lot of groups and seminars out there to help people. So how does a sedentary lifestyle actually affect your body? One of the most obvious is an increase in body fat or obesity. Obesity is then linked to an increase of cardiovascular disease, diabetes, hypertension, and high cholesterol. The risk of cardiovascular disease increases due to poor circulation, which then causes blood vessels to become stiff, blocked, and decreases the blood supply to your heart. The heart then becomes weakened, loses its flexibility, thus the increase of the risk of cardiovascular disease. Lack of activity can affect mental health, increasing a person's risk for depression. Dr. James Blumenthal conducted an experimental study with sedentary adults diagnosed with major depressive disorder and separated them into 4 groups: supervised exercise, home-based exercise, antidepressant therapy, and a placebo pill. After 4 months, Dr. Blumenthal found that patients in the exercise and antidepressant groups had higher rates of remission than the placebo group. He concluded that exercise was comparable to antidepressants for those with major depressive disorder, and exercise seems not only important for treating depression, but also in preventing the relapse of depression. It's not completely clear as to why exercise has been shown to improve moods, but it could be an increase in the serotonin levels. They are now urging professors at universities to educate psychology majors on the importance of this. The benefits of activity far outweigh the risk of no activity. According to the ACE Essentials of Exercise Science, some benefits of regular exercise include improved cardiovascular function, lower systolic and diastolic blood pressure, a decrease in your body weight and fat mass, improved lipid profile and glucose control, decrease in anxiety and depression, and decrease of osteoporosis and several cancers. The American Heart Association recommends 150 minutes per week of moderate exercise or 75 minutes of vigorous exercise, including both aerobic activity and strength training exercises. Teaching kids good habits and the importance of a healthy lifestyle can decrease the chance of obesity as a teenager. The first few years of life help to develop habits throughout their life. Taking them out to the garden, cutting the grass, walking the dog, and playing sports will all encourage this. Educating people on the risks and benefits can greatly encourage them to engage in an active lifestyle before it is too late. Okay, and these are the people that I have in my video.